where we left off. So you've gone through the whole assessment with me, I've gotten your whole story, I started to put your puzzle together, and 2 weeks later after the blood draw, I get your results in the mail. This is actually really the most exciting part for me, because putting together your diet plan that's unique to you, that's just where it all comes together for me. So the first thing about putting that diet together is understanding that the compounding factors that go into that diet planning. So I don't just look at your MRT results and put your diet together. In fact, it actually comes with a predetermined diet based off of the computer printout. I don't use that because I know more about you obviously than a computer does. So for example, so the LEAP stands for lifestyle, eating, and performance, and that's the part of the training that I went through, the immunology training, that allows me to now be a certified LEAP therapist. So as I create your diet, I think about what are all the things wrong with you, what are your other symptoms. So you might have patterns. For example, on that symptom survey, there's a few different sections on there that reveal patterns to you that you maybe have a histamine intolerance. Maybe some patients have told me they have an oxalate intolerance. I'm not so sure that's true or not, but they believe they have it, so I take oxalates out. They might be, well, for sure they're already, everybody follows the gluten-free, dairy-free, soy-free, and corn-free diet initially. They don't all stay that way long-term, but those are our 4 most allergenic antigens. The other thing that goes into this, so headaches would have certain protocols. Gas, I mean, if you come back low reactive to cauliflower on your MRT, I'm not giving you cauliflower because it causes gas. I'm not going to give you cucumber, I'm not going to give you broccoli, any of those cruciferous things that cause poor digestion, at least when they're raw. So this is not a elimination diet. It's my biggest pet peeve. Oh, it's just like an elimination diet. No, sorry, it's not. It's actually an inclusive diet. It's exactly the opposite of elimination diet, because I take everything out of your diet except for your least inflammatory 10 or 20 foods that are not contraindicated with something else, right? So those are based on your MRT results and your symptoms, but as a little bit your lifestyle too. So if you come to me and you're on a tight budget, none of my stuff is covered by insurance, I'm not going to give you halibut in your first phase, very likely. Probably not going to give you, some of those other really expensive foods. I'm going to give you foods that are comfortable and familiar to you, easy for you to cook, easy for you to access. So again, it's the complete elimination of all foods except for the 10 or 20 least inflammatory that are contraindicated. And then we go through a plan of food introduction. So the biggest goal of our program is gut healing. And once we heal the gut, then the immune system calms down and everything it's like a good domino effect. Now everything starts to work better, everything starts to heal itself. There's a ton of different gut healing protocols out there. There's nothing wrong with any of them. They're all really good, but this one is the fastest and most effective that I've ever seen. Because like I said, with our patient example that Ron was just talking about, she was 60% better in 10 days. What was your number, Shannon? Do you remember? Yeah, but it was good.
It was good.
Yeah, in 10 days. And it's just food. There's no herbs, no endocannabinoid supports. There's nothing. It's just food. That's what's so remarkable about it. And then you get training from me or coaching from me. So it takes your understanding of food to a completely different level. So, for example, I went through this program myself just so I could learn it because I wanted to experience what my patients would experience. And there are little things you just don't pay attention to. You think, oh, this is a short ingredient list. There's only 2 things in it. What if that second thing on that list is sodium metabisulfites, right? Oh, okay. But this isn't what I thought I was eating. So, or if that second ingredient is guar gum. Interesting. I can't have this product now because it's not totally clean. So it takes label reading to a whole new level. It takes understanding of shopping to a whole new level. Menu creation, cooking, all of that. It's so finite and it's so specific to you. What the other thing that's really interesting about this is, most of my patients that come to me are already eating pretty clean because they've already seen a number of other providers such as yourselves, or they've worked with other people. They've networked with other people that have told them what to eat or what to change. And they're eating things that you would find on the anti-inflammatory list on Google, right? Like, what is that? Name an anti-inflammatory food on Google.
Blueberries.
Yes. 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 Blueberries, turmeric, ginger, kale, spinach. Yeah, whatever the case may be. But the first time I took this test, I came back reactive to blueberries and raspberries. I was devastated. Like, not only do I love blueberries and raspberries, but I'm a dietitian that was telling people to eat these things. Like, oh my gosh. So it changed the way I practice. Now if people ask me, hey, what's the best anti-inflammatory diet out there? I don't know, you're gonna have to take my test. So I can tell you, but you have to take the test first, okay? So you get coaching from me. In my programs, I have an all-inclusive, full access approach where you can come see me at any time, okay? Or you can call me at any time if you live across the country or in another country. So that's a little bit about the food part of the program. So this is just a sample eating plan. Don't get hung up on the details because everybody's plan is different, but I try to give you as many proteins as possible because proteins, when you eat them, are what stay with you. Some people are grain-free, depending on who you are. Some people have a really hard time digesting grains. Other people do not. But you'll always, as much as possible, have some kind of starch. There's always going to be some vegetables, some fruit, definitely no dairy, some kind of nuts and seeds if you don't have a predisposition to not having them. If that's the case, then what I'll try to do, different fats like olive, coconut, things like that. It's kind of, it depends on who you are. And then different spices. So, 25 to 75% resolution after just 10 days with just food is what most of my patients experience. Of course, there's always some outliers. There's a few that maybe only get 10 or 20. Then we start to send up other questions, right? Okay, what else is going on? I've had outliers on the other end. I've had 95% resolution too. And we do measure this on the symptom survey. Most of my patients are somewhere between 50 and 90% by the end of phase 5. And that's what's really fascinating, because then I can look at that symptom survey and we can figure out, okay, so these are the things that are left. These are the things that we have to address with supplements, or maybe this is the other provider that you should see in order to fix that. There are 2 different methods of food introduction. Some of my patients do one new food every day. They eat that new food 2 times in the first day under a normal serving size, and then they wait and see what happens. If there's no reaction, they keep eating it. Okay? Other patients, depending on their progress after the first phase, may do one new food every 3rd day method because their body is slower to send a message. The healing hasn't optimized quite as much as we want it to. Because it can take, so food sensitivities can show up 30 minutes after you eat or 3 days. So that's why some patients really have to do that one new food every 3rd day method so that your body has time to respond. In that case, you do 2 times the first day, 2 times the 2nd day, don't eat it at all the 3rd day. If there's no reaction, then on the 4th day you can start eating it every day. My patients always ask me, well, how will I know? How do you know? I can't tell you. Everybody's different. Everybody experiences something very unique. And what people tell me all the time is, oh yeah, I knew. I could tell you the minute I ate green beans, that was not a food that was gonna work for me. So, and a lot of patients will tell me, I used to eat green beans all the time, I had no idea. That's because it was in the mud, it was in the mess, right? It's not, there's no clarity to it. So, sometimes it's a headache, sometimes it's joint pain, sometimes it's fatigue. Everybody's different. You'll know it because you're so in tune to your body. After you're 25 to 75% better in 10 days, you're very in tune. And so when something's off track, it'll tell you. Phase 6 is really, so MRT only tests 140 foods. There's way more than 140 foods on the planet. So people start to kind of like, well, when can I eat butter? When can I eat radishes? When can I eat walleye, especially if you live in Minnesota? Well, I'll tell you, you can do that in phase 6. It's also when we start to introduce supplements, and we also test our reactive foods. There's no reason to stay away from foods permanently or long-term if you don't need to, right? Our goal, aside from healing the gut and getting the immune system working the way it's supposed to, is to create a food list that's enormous. So you're so free to eat anything and everything that you know is good for you without having to worry about those maybe few things that you can't eat, okay? So my asterisk there, and I'm honest with every patient that has fluoroquinolone toxicity, these are my normal results. you might see about half that. Okay, it's just how it is. Although we've had some good outliers with that too. Some of the key supplements. So a lot of my supplement recommendations do come from our SpectraCell test. It's not a perfect test, but it's one tool. I recommend that it's used in conjunction with other tests that you would use with your other naturopathic doctors or functional doctors, whatever. Different, even conventional tests can support that. Recommendations also come based on the relationship between vitamins and minerals. I was at my doctor one time showing her my SpectraCell results, and my SpectraCell results showed I was deficient in calcium. And I was actually there for my B12 deficiency. I just wanted an injection. But since there was no evidence to support that she'd give me one, she wouldn't give it to me. Okay, whatever, that's beside the point. But she kept talking about my calcium. I'm really concerned about your calcium. Like, lady, you don't understand calcium. I'm not taking calcium. So if you have a calcium deficiency, we're gonna give you all of the things that support calcium, not just calcium. I see your head's shaking, thank you. I'm also gonna be really watchful of reactive ingredients. So one of my patients right now has a rice reactivity. Well, I mean, rice is probably one of the most common starchy fillers now in supplements because so many people are looking for gluten-free. So we're struggling with, okay, well, what do we do for her? So we're having to dig a little deeper into that kind of thing. We also give supplements based on symptoms. You might not show a deficiency for it, but you probably need it. Sleep is a common symptom that we continue to address. Rarely are there digestive systems at this point, but we look at fatigue is another one. There's quite a few that will come up at the end that we have to address. We also review what were the patients taking before they came to me, because like I said, a lot of them have already been to people such as yourself, and they've got a really good list of things that they're taking. And so sometimes, and this is all teamwork. This is teamwork with the other provider, teamwork with the patient. Which of these supplements are very important to you to get back in? Which ones do you think we're helping? Whether it's based on your experience with them and the symptoms, or based on blood tests that you've gotten from your provider. Let's get those back in if they're necessary. So, specific to fluoroquinolone patients, we want to look at adverse reactions for the patients. So specifically, some of my patients are taking curcumin, right, or turmeric before they come in because they heard on Google that it's an anti-inflammatory. So they're taking high doses of it, but now they've been shown reactive to it on the MRT. So now we have to figure something else out. Or same with fish oil. So you might be reactive to different kinds of fish. So guess what? Now we have to find you a different omega-3. Definitely we give oxidative stress support. So antioxidants, definitely, very likely vitamin C, vitamin E, glutathione type support, not necessarily glutathione directly because that's not necessarily well absorbed, but all of that kind of support. So these are things that no matter who you are, I always discuss it. If someone forced me to pick one supplement, it'd be one of these four. So digestive enzymes, you're not digesting your food, you're not getting what you need out of your food, you're not going to get nutrient optimization. So digestive enzymes are really great for helping break food down at the point of digestion. I mean, if your body is going to use it, it's going to use it from that point forward. I like enzymes that are comprehensive with hydrochloric acid support as well as bile support. It's just more comprehensive that way. We always talk about probiotics, but I don't necessarily always recommend them. I don't know that everybody needs them. They don't live in your body long term. They're used on occasion to support your own microbiome. And so I think it's one of probably the most over-recommended supplements. And it's probably something that most people could get by with taking on an occasional basis. Like I take it if I feel like, okay, I've got a head cold coming on or something like that, or I might take it if my nieces were over and they were sick, or it's just Christmas and you're around with other stuff. Okay, so take it prophylactically. I don't take it on a regular basis. Fish oil is not measured at all on the SpectraCell, and I don't have another way of measuring it. There are other tests that do measure your omega-3s. Cardiometabolic testing will do that, but I don't do that one with every patient. That one's optional. So we talk about it, if there's value for that person in taking it, then I help them figure that out. But I hate when a patient, comes to me and they're inundated with this massive box load of supplements when they walk out the door. That's not my intention ever. But my newest favorite is phosphatidylcholine. Have any of you ever experimented with this? I love it. Like, what did it do for you? Like within days? Yeah.
Brain fog, for sure. Memory.
Right. So now if you ask me what my favorite supplement is, it might be that one.
Many of them are derived from soy, so some patients may have to be careful.
Yep. So the brand that I use is the Body Bio. Yeah.
I take that.
Yeah, that's the one that is derived from soy.
It's gross.
Yeah.
It's very nasty, but it works.
Yeah, but there's no soy protein left in it. They've extracted it to the degree that there's no soy left in it.
Body Bio is really disgusting.
Body Bio PC, right? Is what it's called.
Oh, it's the powders?
No, I take the gel cap.
Oh, you took the gel cap. I have the liquid form.
Yeah, gross.
I could literally throw up right now thinking about it. I didn't bring it with me.
Yeah.
Conveniently forget that. Maybe
There's an
switch.
empty factor, but I do that as soy.
It's the color of chocolate.
Probably. I think that's the most abundant source of it, which is why they all extract it from that. But yeah.
The serine works great too for brain.
Sure.
Which one?
Sure. L-serine. Yeah, so I love that one, and I'll tell you, I take everything on myself first before I give it to any of my patients just to experiment and see what happens. And it was within about 5 days that I went, oh, I'm responding to this differently than I would have responded 5 days ago. Okay, I like this new stability. I like it.
Do you use brain octane?
No, I have not used that
It's
one.
really good too.
Yeah.
It's not nearly as nasty.
Yeah. So phosphatidylcholine, this one, the Body Bio PC, is fairly expensive. So that's why I talk about all these with patients, and ultimately they're the driver of the bus. I just sit on the seat with them, and I kind of, show them this is a good turn. This is maybe a turn you don't want to take, or if you want to just stay in the straight and narrow, this is how we would do it. So that's just a sample page of the Spectre cell deficiency and insufficiency report. But again, that's just one piece of the puzzle. Dr. Galili, yes, go ahead.
So what do you like for sleep and you talked about sleep and for fatigue?
Yeah.
Excellent.
Yeah, this is where we're going. So, he laid the foundation really nicely for magnesium. I mean, magnesium, so this would be the other one that we always talk about too, and this is probably the one, if I was gonna get married to one of them, I would marry this one, because it fixes everything. So, I'm gonna hand out this, it's just a guide. There's so many different types of magnesium, and it's important to know what each of them is capable of doing, the side effects of each of them. Yeah. I don't have a full list, but I can get more later. So this is my absolute favorite product. Some of my patients are taking like a liquid ionic form of magnesium. That one works really great too, but I find compliance with that one is a little bit lower because it tastes like crap, right? So it's harder to carry that around too. I mean, sometimes it's in a big bottle, sometimes it's little, but so that one is readily absorbed. You don't even need to digest liquid ionic magnesium, right? It just absorbs. But this one has 3 types in it. You'll see that the 3 types on that list, they're all really supportive of nerve and neurological function. So it's the malate, the threonate, and then the glycinate. So they're all the chelated. This one I especially like because it's clean. There's no other ingredient in it. There's no flavor. There's a couple that are exactly like this that are flavored. I don't give my patients anything with natural flavor because I don't know what it is. So
Is that Zymogen?
it is, yeah. This is the one I take 200 milligrams, which is 1 scoop every night before bed. The directions are to mix it in water and then drink it, but literally I just dump it right in my mouth and then I chase it with water because otherwise it sticks to the glass and I have to keep drinking it and it tastes like crap. So I just throw it right in my mouth. My patients, so I had a patient, not fluoroquinolone toxicity patient, but just chronic fatigue. He's 18, he's had fatigue for, 16 years. And he was going through the diet process. After 10 days, he didn't have significant improvement, which is really unusual. Okay, so what else do I need to do? I gave him 400 milligrams before bed. He was a completely different person already after just one day. So that's pretty rare. I mean, usually you have to kind of build up your storage a little bit before you have that kind of impact, but his was right away. So that was pretty fascinating. So we lose kidney in a lot of ways, and it's especially deficient in fluoroquinolone patients because, as Dr. Collet said, it's the ions, the receptors are replaced with fluoride, so your body just doesn't take it in anymore, it just gets rid of it. So I usually start low and slowly increase it over time, just to be on the safe side. I don't want to over inundate you and end up with side effects. Magnesium would only be contraindicated in a few situations. Hypoparathyroid is one, and end-stage renal failure is another. There's a few others that are more rare.
You have to be careful, sorry.
Yep.
If a patient has an active ulcer, if you feed oral magnesium, the way the ulcer works, you'll get too much absorbed at once. You can get straight paralysis from having too high magnesium levels. I've seen it happen with Pepto-Bismol.
Oh, interesting.
And patients in ICU, yes, they just get up, they collapse because their magnesium levels are like 8 or 9 when it should be.
Actually, I think Dr. Alan Gavey wrote about that in his functional nutrition book. Yeah,
I've seen that
you're
multiple times. So
Yeah.
That's the only time to be careful with magnesium.
Okay.
Especially kidney function, make sure creatinine is obviously within normal limits
Yeah.
before you start prescribing a lot, and no active ulcers.
Yeah, okay, yeah, good to know. So, I mean, we already know a lot of this. I mean, Dr. Collet highlighted some of this, but I mean, it's just so important. I mean, I would say there isn't really anybody that comes to my practice that I don't say you should take some magnesium of one form or another. Athletes might take a little bit different form than this. You know, everybody's a little bit different what they need, why they take it. I might give you some types just specifically for bowel movement support, but. So I want to talk a little bit about, as we go through this process, what are some of the influencing variables, especially related to fluoroquinolone toxicity? So, because I'm up front with patients, right from that first conversation, these are the results you can expect. They're going to be a little bit different than my average patient. The younger you are, the more likely you will respond really well, the more resilient you are. I'm not so sure about gender, that's why there's a question mark there, but thus far, without tracking data, I feel like I've had better success with men than I have with women. Yeah. Right, so, and then the length of time with toxicity, if I'm catching you at 3 months or 6 months, that's a whole lot different than 2 to 5 years, okay? Commitment, some people are really afraid to let go of what they've already been doing, and they have to let go of it in order to do my process, because my process is just food, especially for the first 10 days. They have to trust me. Jason was one of my patients that trusted me explicitly, and he did really, really well. And then the work prior, so patients that have been eating clean already do better than the ones that were not. And then Dr. Hansen and I have talked a little bit about, we're not really sure within that fluoroquinolone class of drugs which one is most toxic, and maybe that's even gender related too. Some of the most common concerns, I get this question every single time, will I lose weight on this program? Yep, can't help it, it's just gonna happen. It's a side effect, it's natural, it's normal. But I've already lost so much weight, I can't lose any more. I can't help that, it's a side effect, but what I will tell you is that's okay, because the weight that we're losing is inflammation, right? We're not losing, you know, weight that is necessary at that moment in time anyway, and I can teach you how to put weight back on, and everybody rebounds and gains their weight back, and then some. The most common concern aside from weight loss, really I have to quit taking all my supplements. Yes, you do. You have to quit taking them. They're creating a barrier for digestion, or for optimizing digestion, at least for this period of time. I can guarantee you, after 14 days, you're not going to be dead without those supplements, so let's let it go. We'll get the ones back in that need to come back in sooner rather than later, and we'll go through that process. The only things that would continue would be like trace mineral, because all it is minerals. There's no ingredients in there, you're not digesting it. And then hormone. I wouldn't probably interfere with hormone. So the other thing that can confuse the patient is that they're running multiple tests at one time from a variety of providers. And that's okay, but what I'll tell you with this program is it resets just about everything. So if you did hormone testing right before you do this program, it's not be the same as when you do it afterward. Because if we get inflammation under control, we're resetting hormones. There's all kinds of things that if you're getting treated at your old baseline, we're gonna need to change. So you're gonna need to retest. So in some cases, I encourage patients, you know, ultimately there's a bus driver, but maybe you just wanna wait till you're into like week 4 or 6 to run that test, just to be on the safe side. I even had one patient told me that her provider told her this. I don't know if that's what the provider said, but the provider she heard anyway, that, well, my doctor says I shouldn't do this protocol until I've healed my gut. I'm like, well, this does heal the gut. So, I mean, you get to pick what route you want to take, but this heals the gut. So let's do this, and then you can go out and do all those other tests. Because I'll tell you, about 90% of the time, those other tests aren't necessary. Sometimes they are, but sometimes they're not. Trusted resources for information. Like which one of our patients isn't part of a group, right? That's giving them all this information. And that really kind of leads into unfounded fears. I had one patient that created this diet plan for her based on everything I knew about her. Oh, but I can't eat oxalates. Well, okay, but we can take those out. Oh, and I can't eat nightshades. Well, and I can't eat any green. And I can't eat this, and I can't eat that. Well, what are you gonna eat? So, you either need to trust me and let this program do its job, or you can figure it out if you want to, but then I can't help you. So, let go of it. Trust your body, trust the process. Let's find out. I'll take nightshades out, I'll take oxalates out, I'll take grains out, but let's introduce them one at a time and let your body tell you what works, because everybody's different. Just because everybody else is grain-free doesn't mean that you have to be. Do I support gluten-free? Sure. That's a well-known factor for gut permeability. But I also tell the patient, you're still the driver of that bus. You find out you can eat it, maybe you can enjoy it once in a while. Maybe it's not the end of the world to have it once in a while. But your body is the determiner of that. So I encourage people to let go of those fears of food. So that's it for treatment.